Sutter base, this is 1. The time is 9:30. Go ahead, please.
Sutter's the medic 20, coming in code 3, stroke alert. On board I have a 30-year-old female, sudden onset witnessed by fire. Patient has left-sided facial droop, left arm and left leg weakness with slurred speech. She's an AFib on the monitor, rate at 130, blood pressure is 210 over 125, satting at 100 on room air.
Do you have a blood glucose result?
Blood sugar is 150.
Thank you. The patient will go to room 4. Sutter out. Hi, Jenny Lee. Can you please call the stroke alert? The patient will go to room 4.
Okay.
Code phone.
Stroke alert, room 4, ETA 10 minutes.
Okay, thank you.
Okay, thanks.
Stroke alert, emergency department, now, room 4. Stroke alert, emergency department, now, room 4.
Hi, Mrs. Jones. I'm Leslie. I'm going to be one of the nurses taking care of you today. I'm going to get a report from the EMS guys about what's going on with you. We're the whole stroke team. We're going to take good care of you today. Juan's going to be your primary nurse, and I'm just going to get the information from the guys about what's going on, okay? But we're going to take good care of you, so I don't want you to worry, okay?
We have a 30-year-old female, sudden onset of left-sided weakness, weakness to left arm and left leg with facial droop. She's hypertensive at 215 over 110. AFib on the monitor at 130. She has an 18 gauge in the right AC and a sugar at 150.
What was our last known well time?
Approximately 10 minutes ago. It was witnessed by the fire department.
Any allergies or medications?
No known allergies, history of high blood pressure.
Okay. Family en route?
Yeah.
Thank you.
Ready?
1,
2, 3. Okay, Alan. Please secure the airway. Ali, the IV access, and Aurora, the blood.
Hi, Chrissy. I'm Allie. I'm another nurse here, works with Juan in the ED, and I'm going to be putting in your IV site. It should just take a couple of minutes.
Chrissy, how's your breathing feeling right now?
Okay.
Okay. We need Dr. Milton here right away. Are you okay? So my name is Juan. I'm going to be your primary nurse.
Hi, guys. Hi, Miss Jones. I'm Dr. Melton. How are you feeling today?
Not good.
And can you tell me a little bit about what happened?
Well, I felt dizzy, and then my left side went weak. Right face is drooping.
We're worried that you may have had a stroke. So there's going to be a lot of activity going on. We're going to get some blood drawn. You're going to be going shortly down to get a head CT. Okay, that's going to take a picture of your brain to try and determine what might be going on. In the meantime, I'm going to start doing an assessment, which is a neurologic exam, okay? So I'm going to be asking you to do various things as we go through these maneuvers. Okay, Ms. Jones, so I'm going to have you do a few things for me. Can you follow my finger with your eyes? Very good. Can you show me your teeth? Great. And close your eyes real tight. Good. And then scrunch your eyebrows up. Bring them all the way up. Good. Very good. Okay. Now what I'm going to do is I'm going to hold your arm up. Okay. And we're going to have you keep it there for 10 seconds. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. And now let's try it on this side. This side feels weak? Okay. Let's see how well you can do here. 1, 2, 3, 4. Good. Okay. Now we're going to ask you a series of questions. Can you repeat these terms for me?
Top. 50. Thanks.
Thank you. Good. Okay, now we're gonna test the strength in your legs. Okay, so we're gonna pull your I'm going to lift this up and you hold it there for 5 seconds, okay? 1, 2, 3, 4, 5. Great. Now we're going to lift this one up and do your best. 1, 2, 3, good. Okay, Ms. Jones, so now I'm going to test your sensory, okay? So I'm going to touch you with this, with the needle, and you just tell me if it feels sharp, okay? Do you feel that? Does it feel equal? Is it less on the left side? Okay.
So Leslie, can you please call the pharmacy? The weight of the patient is 73.4 kilograms. So in case that we need a TPA for this patient, and if you can please also call the speech therapy to alert that the patient is here.
I will do that right.
Thank you. And if you can call the CT that the patient is coming.
CT's where?
Thank you. We're gonna go to the CT scan and we're gonna do the CT of your head. In order to do that, we have to put you in the monitor. Okay. And the CT is aware that you are coming, so there's no delay of your care. Okay, moving in. Okay, go front.
Stroke is the third leading cause of death in America and the leading cause of disability. The challenge with stroke care is remains the difficulty of the general public in recognizing stroke symptoms and seeking care immediately. Things such as numbness, difficulty speaking, dizziness, confusion, subtle symptoms can also represent stroke. And it is very important for patients and their families to recognize these symptoms and seek care immediately. In an effort to improve stroke care in America, stroke centers have been established throughout the U.S. The goal of a primary stroke center is to provide immediate and rapid care of a stroke patient presenting to an emergency department. Here at Sutter Solano, we are a primary care stroke center certified. And what this involves is when a patient arrives, we very quickly assess them. We obtain labs, a CT scan. This helps us to determine if patients are eligible for really the only acute treatment for ischemic stroke care, and that is TPA, or a medication which can help dissolve a recent stroke in a patient's brain. Another key component of primary stroke centers is the treatment of patients once a stroke has been initially treated in the emergency department. There is a team of professionals involving speech therapy, physical therapy, neurologists, and skilled hospitalists that can help provide the highest standard of post-stroke care and rehabilitation. This ultimately leads to a decrease in overall disability, which is, for those patients surviving a stroke, the primary concern and goal. One message we have for the community is that if you or someone that is with you is having signs or symptoms of a stroke, or you feel that this is a possibility, to please call 911 immediately, because stroke care, the treatments that we have for stroke, the effective treatments that we have for stroke care need to be instituted immediately for them to be effective. And the number one barrier to the treatment of strokes in America is delayed treatment.
Primary Stroke Center certification allows us to provide resources to the community that would not otherwise be available. Timely identification is critical when patients have strokes, and our ability to intervene and treat those patients and or get them sent to the appropriate level of care improves their quality of life.
Treating stroke quickly by following standardized protocols and guidelines has a significant impact on improving patient outcomes.
Professional and public education is important. Each educational event represents a partnership opportunity to expand knowledge about stroke, diagnosis, optimal treatment, risk factor reduction, and presentation, as well as an opportunity to promote the excellence of our center.
Okay, the patient is here. Lower the head a bit.
Hello, I'm Jeff. We'll be doing a CAT scan of you. This takes about 2 or 3 minutes. We're going to get you on this table. You're just going to have to keep your head really still. We'll take some pictures of you, okay? All right, everybody. We use the hover mat.
Okay.
All connected. This is going to blow up. So nice and slow. We're going to slide you over.
Okay, let me count. 1, 2, 3.
Good, got it. We're going to take away your pillow. Go ahead and relax your head down. In just a minute, we're going to slide you up in bed, and we'll take some pictures, okay, on 3. 1, 2, 3. Head down. Good. I'm going to put a little strap on. That's good. Okay, you're going to raise you up a little bit. This takes about 2 minutes, okay? Nice and still. Doing really good. She's actually doing a picture.
Chrissy, I'm just going to put the blood pressure cuff on.
Okay, Christy, I'm gonna do the swallow screen. I would like to know if you can you swallow or not. Okay. Can you tell me your name? Okay. So you failed the swallow screen because your speech is not clear. In that case, I will call the speech therapy to come and evaluate you further. And she is here and she will talk to you.
Hi, good afternoon. How are you? My name is Carolyn, and I'm the speech and swallowing therapist here at the hospital. So what I first want to do is let you know a little bit about the procedure, what I'm going to do today, make sure that you're the patient that I actually want to see, and we're going to move on from there. So first, can you tell me your name? I've come down to see you today to see how your swallow is working. We want to make sure that when you're swallowing, the food and liquid are going down the correct way and not getting into your lungs. And if it gets in your lungs, it might cause pneumonia. So we want to make sure that your swallow is working okay. Sometimes the muscles in your throat will get affected, just like the muscles are weak in your arm or your leg. So we want to make sure that everything's doing all right before we give you anything to eat or drink. So that's my job. I'm here to assess your swallowing. So what I want to do now is ask you to do a few things for me with the muscles of your mouth and your tongue. This whole evaluation won't take probably longer than maybe a half hour or so. So I want to make sure that it's okay with you if we start now. Would that be all right? Okay.
F is for face. Does one side of their face droop?
A equals arm. Is an arm or a leg weak on one side?
S is for speech. Is their speech slurred or garbled?
T equals time, time equals brain. Call 911, stroke alert now.